Zanesville Lymont Subido, a student nurse from PLT College Incorporated and from BSN 2C Jane Watson, and today I will be performing bag technique.
Its content. In the front of the bag, the first one is the adhesive plaster, tape measure, thermometer, cotton applicator. On the right rear of the bag, 2 test tubes, medicine dropper, test tube holder, alcohol lamp. On the left rear of the bag, medicine glass, bandage scissor, and baby scale. On the back of the bag, the first one is the 70% alcohol, betadine solution, hydrogen peroxide, terramycin ophthalmic ointment, Zephyrin solution, spirit of ammonia, acetic acid, Benedict solution, liquid soap, and cotton in sterile water. In the center of the bag, 2 pairs of forceps, curved and straight. Surgical scissors, roller bandage, syringe 5 ml and 2 ml, sterile cord clamp, and kidney basin. On the top pile, center of the bag, the first one is the hand towel, soap in soap dish, apron, and plastic lining. In the pocket of the bag, surgical gloves, extra paper for making bag for waste materials.
For the assessment, gather all equipment needed, such as your station bag and its content, as well as other paraphernalia such as your logbook, your BP app and stethoscope. Next is identify your client and explain the procedure. Good day, ma'am. I am Zanesville Lymont Subido, a student nurse from PLT College Incorporated, and today I will be performing bag technique for your home visit. Is it okay, ma'am?
Yes.
This is actually important, ma'am, for us to assess and provide your proper health needs and for us to know your family situation. So after introducing yourself to the client and explaining the procedure to her, now observe the client and provide a privacy. So in providing privacy, always remember to close curtains and doors if they have any. So ma'am, are you okay with closing the curtains and doors?
Yes, please.
Okay, ma'am, thank you. So in providing the privacy, it enables the client to have a sense of security and have a safe environment.
So in planning, first, formulate your nursing objectives in the home visit. In planning for the home visit, make sure to consider and give priority for the assessment and recognize the individual needs and family. Remember, planning should be flexible.
So for implementation, upon arriving at the client's house, locate a flat surface or any tables that is flat and get your paper lining from your bag And always make sure that the clean is on top and the folded part is touching the flat surface. So after putting the paper lining on the table, now put your equipment on the upper corner of the table. So in putting your bag on the table, always make sure that the handles is beneath the CHN bag. So remember that the CHN bag should be 6 feet away from your client to prevent the contamination of your equipments. So if the client doesn't have any tap water, ask for a basin and a water or a glass of water for you to do a hand washing. So now, get your plastic lining of your CHN bag and put it on the table. So always remember that the clean part should be on top and the folded part should be touching the table. This is to ensure that you have a non-contaminated area and a clean working place. And now, you may take out the towel, the soap dish, and the apron from the bag. Put it in a warm place. And now, close the bag for us to prevent the microorganism to get into the bag. So now we can take off the plastic covering the hand towel and the apron. So these plastic covers should be put in the bag. So these equipments will be used in hand washing. And now we can do the hand washing. So always remember that pat your hands with dry towel.
So basically, hand washing is the first step in preventing infection to transfer from the care provider, you, to the client.
Now, after the hand washing is done, get the apron from the table and put it on. Apron is used as protection from any splashes. So now, after putting on your apron, now you can take out the important equipment that you will be using on your specific case, like for pregnant women, newborn babies, for postpartum mothers, and even school-age children. So these equipments are the 70% alcohol, cotton balls, thermometer, kidney basin. You should put them in a one place or one corner for easy access. And you should also have a BP apparatus and the stethoscope. So after gathering your equipment and putting it on the table for your specific case, now you can take out the paper waste bag. And you can put this away from the table for us to prevent any contaminations. And now, after putting out all your gathered equipment, we can now close the station bag to prevent any microorganism contamination. So, assuming that I am done with the care I provided to the client, now we can go to the aftercare. So, in aftercare, this is to sanitize your all use equipments. So in the aftercare, I will be using 70% alcohol and cotton balls in sanitizing and cleaning the used equipments. This is to ensure that the equipments used in this client is clean and sanitized for the next client. So the used cotton ball should go to the paper waste bag. And now, after cleaning and sanitizing all the equipments used, we can do the hand washing again. So after putting all the equipments inside the CHN bag, now we can take out the plastic bag that was used in the apron. Now take off the apron and fold it. Always make sure that the clean part is always out. And now put it in the plastic bag. And again, put it inside the bag. Close. So after putting the apron on the bag, now we can fold the plastic lining. Again, the clean part outside. Put it in a bag.
Make post-visit conference on matters that are relevant to healthcare, taking any global notes preparatory for final documenting. This is actually important in order to be used as reference for follow-up visits. Make an appointment either home or clinic and take note of the time, date, and purpose. This is vital for follow-up checkup or future visits.
So ma'am, I will be back next week. So the gathered results earlier will be a reference for the next visit. So my next visit will be at the same time I arrive here. And that will be all, ma'am. Thank you. Now, get the station bag from the table and fold the paper lining. Again, clean on the outside. Put it in the bag.
For the client evaluation and documentation, record the findings that are relevant to the client and family members. Take note of environmental factors which affect the client and the family health. Include quality of nurse-patient relationship and then assess the nursing care provided, its effectiveness.